5 signs and symptoms of pancreatic cancer you should know. Pancreatic cancer begins in the tissues of your pancreas, a pear-shaped organ located behind the lower part of your stomach. Pancreatic cancer is difficult to detect early and it typically spreads rapidly, affecting other parts of the body. This is why it is called a silent disease. People often ignore the warning signs of pancreatic cancer until the problem becomes severe. It is important to be aware of these signs, as addressing the problem early can save you from future complications. If you have multiple signs and symptoms of this problem, ask your doctor to check your health levels. Here are the early warning signs of pancreatic cancer that you must know. 1. Jaundice. It is common for people with pancreatic cancer to experience jaundice, characterized by yellowing of the eyes or skin. Jaundice can also cause itchiness on the hands and feet, especially the palms and soles. Any size of tumor located in the head of the pancreas can lead to irregular bile, a yellowish-brown fluid released by your liver to aid digestion, flowing from the gallbladder into the small intestine. This causes excess buildup of bilirubin in the blood, one of the main causes of jaundice. If you have signs of jaundice, consult your doctor, as it is a common symptom of many liver and gallbladder diseases as well as a sign of pancreatic cancer. If other causes are ruled out, ask your doctor about testing for pancreatic cancer. 2. Abdominal and lower back pain. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. Abdominal as well as back pain are also common symptoms in patients with pancreatic cancer. Usually, the sharp pain is felt in the upper abdomen, which gradually radiates toward the back. Many patients also report the pain is more severe at night and that they get slight relief from the pain by bending forward. A 2001 study published in the Pancreas Journal found that abdominal pain in pancreatic cancer patients can be due to the increasing size of the tumor, invasion of the intrapancreatic nerves, invasion of the anterior pancreatic capsule, and lymph node metastasis. If you are experiencing persistent, mild to moderate abdominal pain, consult a doctor. Most cases of pancreatic cancer are diagnosed in patients visiting the emergency room complaining of severe abdominal pain. In fact, the location of the pain is helpful in determining where a tumor is located. 3. Nausea and vomiting. Nausea followed by vomiting is another sign of pancreatic cancer. As the tumor grows, it can block some portions of the digestive tract, which hampers the overall digestion process. Along with nausea and vomiting, you may also experience heartburn and acid reflux. As any kind of interference with normal digestion and excretion processes can cause vomiting, all nausea and vomiting episodes are not necessarily linked with cancer. Try peppermint or ginger tea as well as limiting your water intake with meals, but drink water between meals to reduce nausea. If these symptoms tend to worsen after eating and it is becoming difficult for you to eat anything without throwing up, consult your doctor. In advanced cases of pancreatic cancer, surgery may be required to bypass the blockage and improve digestion. 4. Unexplained weight loss. Unexplained weight loss is another noticeable warning sign of different types of cancer, including pancreatic cancer. Weight loss often occurs when a tumor spreads to nearby organs and impairs their functioning. This affects proper digestion of nutrients and also leads to poor appetite. Also, due to lack of pancreatic enzymes aiding digestion, dietary fats start passing through the body undigested, which in turn causes weight loss. Furthermore, the cancer cells compete with healthy cells for nutrients. If you have started losing weight suddenly without making any changes to your diet or physical activity, consult your doctor. 5. Greasy or light-colored stool. Stools of people suffering from pancreatic cancer have some distinct characteristics. The stools may become large, pale, oily, floating and smelly as the growing tumor prevents the pancreas from releasing its digestive enzymes. These enzymes are needed to digest food, especially fatty food. The undigested fat ultimately ends up in your stool, making it float or look greasy. These fatty stools are difficult to flush away. Furthermore, stools turn a lighter color due to the lack of bilirubin. As the color and consistency of your stool says a lot about your health, any kind of bowel changes should be reported to your doctor. 6. Changes in urine color. Along with changes in your stools, you may also notice changes in your urine color, despite drinking enough fluid throughout the day. Your urine may become darker and take on an orange, amber or brown shade. A growing pancreatic tumor can cause bile to get blocked and not released from your body in the way that it should be. Too much bilirubin in the body can get into your urine and make it dark in appearance. At times, there also may be traces of blood in your urine. If you notice that your urine has become darker in color without any dietary explanation, it is important to find out the cause behind it. 7. Lack of appetite. People who have pancreatic cancer also notice a sudden drop in their appetite and a tendency to feel full after eating very little. As the tumor starts growing, it can cause pressure on the stomach or the small intestine, leading to a blockage in the digestive tract. This can make one feel full after eating very little and cause significant loss of appetite as well as weight loss. Remember, significant changes in appetite can make a person weak and tired, which can even hinder treatment as well as recovery. This is why it's vital to consult your doctor if you have persistent, diminished appetite combined with significant weight loss. 8. Bloating. As the pancreas is an integral part of the digestive system, the presence of a tumor can cause several gastrointestinal symptoms, including bloating, gas and inflammation in the abdomen. Bloating and gas generally develop after eating a meal and may even be accompanied by heartburn or indigestion. These symptoms occur when the tumor in the pancreas starts exerting pressure on the stomach and abdomen, making it difficult for the stomach to function properly. 9. Constant fatigue and weakness. General weakness and fatigue, without any change in diet and physical activity, can be an early symptom of pancreatic cancer. In this context, fatigue can be due to the increasing growth of the tumor itself, lack of sleep due to pain or other reasons, and anemia due to loss of appetite. Improper eating also takes a toll on your energy level and you may feel the need to rest and sleep more than usual. If you are feeling weak and fatigued even after getting more sleep and rest, see your doctor to have the problem evaluated. It can be a sign of a variety of cancers as well as other health problems. Early diagnosis increases the success rate of treatment. Here are 10 amazing foods that help heal your pancreas. 1. Garlic. Garlic contains a compound called allicin, which has antioxidant and anti-inflammatory properties as well as pancreatic cancer prevention ability. Garlic also contains other beneficial nutrients, such as sulfur, arginine, oligosaccharides, flavonoids and selenium, which have positive effects on pancreatic tissues. A 2013 study published in the Asian Pacific Journal of Cancer Prevention reports the preventive and therapeutic potential of garlic oil on pancreatic carcinoma cells. It is also highly beneficial for preventing as well as treating diabetes. It has anti-hyperglycemic and lipid-lowering properties. It helps reduce the amount of sugar in the blood and stimulates the pancreas to produce sufficient insulin. A 2011 study published in the Pakistan Journal of Pharmaceutical Sciences found that garlic supplementation with a standard antidiabetic agent provides better blood sugar control in type 2 diabetics. Eat 2 or 3 raw garlic cloves daily on an empty stomach. Also, include garlic in your cooking or take a supplement after consulting a doctor. 2. Probiotic yogurt. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. Yogurt with live, probiotic cultures is another amazing food that is good for your pancreas. Probiotic yogurt helps replace and replenish the healthy bacteria in your gut, which is important for a healthy digestive system. A healthy digestive system is important for pancreatic health. It also has been found to be helpful in treating problems associated with the pancreas. A 2011 study published in Applied and Environmental Microbiology reports that probiotic treatment appears to mitigate pancreatitis in an animal model. The animals treated with probiotics had less infection of remote organs, less infection of dying and dead pancreatic tissues, and less severe immune response during acute pancreatitis. The National Cancer Institute recommends eating 3 servings of low-fat or fat-free yogurt that contains active cultures, probiotics or beneficial bacteria, on a daily basis to enjoy a healthy digestive system and improve pancreatic health. It will even reduce the overall risk of pancreatic cancer and help repair damage to the pancreatic tissues. 3. Spinach. Spinach is a good source of iron and vitamin B, the 2 nutrients that your pancreas needs to function properly. When your body receives these 2 nutrients in adequate amounts, there is less chance of inflammation in the pancreas. Inflammation in the pancreas increases your risk of pancreatic cancer. In fact, spinach contains a powerful cancer-fighting agent called MGDG, monogalactosyl-desulglycerol, that can slow down the growth of cancer cells in the pancreas and induce apoptosis. Spinach is also beneficial for controlling high glucose levels. A 2015 study published in the Journal of the American College of Nutrition found that spinach extracts rich in thylakoids produce an increase in satiety that would be accompanied by the appropriate changes in glucose and lipid measures. Eat spinach on a daily basis, incorporating it into your soups, salads, juices or smoothies. 4. Turmeric. Turmeric, a popular spice used in day-to-day cooking, is also good for your pancreas. It possesses cancer-fighting properties that help prevent many cancers, including pancreatic cancer. The compound curcumin in it is effective in identifying potential cancer cells and aids in destructing these harmful cells without damaging healthy cells. A 2013 study published in Anti-Cancer Research found that a unique turmeric extract known as liposomal curcumin may provide an alternative to chemotherapy in the treatment of lethal pancreatic cancers. Turmeric is also a powerful anti-inflammatory agent that protects your pancreas by preventing inflammation of any kind. This spice is even good for controlling high blood sugar and preventing diabetes. A 2012 study published in Diabetes Care found that curcumin extract effectively reduced the number of pre-diabetic individuals who eventually developed type 2 diabetes mellitus, as well as improved the overall function of SS cells. Add 1 teaspoon of turmeric to a glass of milk and drink it once each day. If you wish to take a supplement, speak with your doctor first. 5. Blueberries. All types of berries are good for your pancreatic health, but blueberries are the best for this purpose. Blueberries are rich in antioxidants, which can protect the pancreas from oxidative stress resulting from free radical damage. These berries can also reduce your risk of developing serious conditions like pancreatic cancer. The compound pterostilbene in berries increases self-destruction of lung, stomach, pancreatic and breast cancer cells. Blueberries also aid in reducing blood sugar levels and are good for people dealing with diabetes. A 2014 study published in the American Journal of Clinical Nutrition showed that intake of fruits and vegetables, berries in particular, was able to reduce the risk of type 2 diabetes. Also, the anti-inflammatory properties of berries aid in reducing vascular damage to the pancreas caused by diabetes. To keep your pancreas healthy, include fresh blueberries in your diet.